Our experimental protocol can address whether prism adaptation therapy is effective for patients with hemifacial neglect and whether our virtual prism adaptation therapy system promotes spatial realignment and cortical activation.
Virtual prism adaptation therapy was developed to be less costly, quicker to set up, and easier to adjust than conventional prism adaptation.
This technique can be used to replace conventional prism therapy in patients with hemispatial neglect because it can mimic the effects of conventional prism adaptation.
This method suggests a potential for using virtual reality for stroke therapy and may give insight into hemispatial neglect rehabilitation within the virtual rehabilitation field.
Although the VPAT system is based on a virtual reality gaming engine and therefore is easily used, be sure to take care with after nurse preparation.
For functional near-infrared spectroscopy measurement setup, have the participant sit in a chair with a straight back and confirm that the participant's hand will not hit the table when reaching out. Next, select the appropriate functional near-infrared spectroscopy size according to the participant's head circumference, and place the cap on the head of the participant so that the vertex is located at the intersection of the midpoint between the inion and nasion and the midpoint between the left preauricular and right preauricular areas. Display the montage on the screen.